dear friends, welcome to Medical Destiny YouTube channel. In this video, you will go through 25 Nclex-Rn nursing exam multiple choice questions and answers. If you would like to get more videos related to nursing and medical topics, please subscribe my channel.
One. A nurse hears the alarm sound on the telemetry monitor, looks at the monitor and notes that a client is in ventricular tachycardia. The nurse rushes to the client's room. Upon reaching the client's bedside, the nurse should take which action first? 1. Call a code. 2. Prepare for cardioversion. 3. Prepare to defibrillate the client. 4. Check the client's level of consciousness. Answer 4. Rationale. Determining unresponsiveness is the first assessment action to take. When a client is in ventricular tachycardia, there is a significant decrease in cardiac output. However, assessing for unresponsiveness helps to determine whether the client is affected by the decreased cardiac output. If the client is unconscious, cardiopulmonary resuscitation is initiated. 2. The nurse assesses a preoperative client. Which question should the nurse ask the client to help determine the client's risk for developing malig, nant hyperthermia in the perioperative period? 1. Have you ever had heat exhaustion or heat stroke? 2. What is the normal range for your body temperature? 3. Do you or any of your family members have frequent infections? 4. Do you or any of your family members have problems with general anesthesia? Answer 4. Rationale. Malignant hyperthermia is a genetic disorder in which a combination of anesthetic agents, the muscle relaxant succinylcholine, and inhalation agents such as halothanes, triggers uncontrolled skeletal muscle contractions that can quickly lead to a potentially fatal hyperthermia. Questioning the client about the family history of general anesthesia problems may reveal this as a risk for the client. Options 1, 2, and 3 are unrelated to this surgical complication. 3. A client has developed oral mucositis as a result of radiation to the head and neck. The nurse should teach the client to incorporate which of the following measures in his or her daily home care routine. 1. Oral hygiene should be performed in the morning and evening. 2. A glass of wine per day will not pose any further harm to the oral cavity. 3. High protein foods such as peanut butter should be incorporated in the diet. 4. A combination of a weak saline and water solution should be used to rinse the mouth before and after each meal. Answer 4. Rationale. Oral mucositis, irritation, inflammation, and ulceration of the mucosa, also known as stomatitis, commonly occurs in clients receiving radiation to the head and neck. Measures need to be taken to soothe the mucosa as well as provide effective cleansing of the oral cavity. A combination of a weak saline and water solution is an effective cleansing agent. Oral hygiene should be performed more frequently than in the morning and evening. Alcohol would dry and irritate the mucosa. Peanut butter has a thick consistency and will stick to the irritated mucosa. 4. A client who works as a security guard at night in an industrial building is brought to the emergency room with suspected carbon monoxide poisoning. Number in order of priority the actions that the nurse takes on arrival of the client. Number 1 is the first action and number 6 is the last action. Closing parenthesis. Blank. Administer 100% oxygen. Blank. Check the blood pressure and pulse. Blank. Check the client's airway for patency. Blank. Draw blood for carboxyhemoglobin levels. Blank. Document assessment findings, treatment, and client response. Blank. Notify the local health department and request an inspection at the industrial building. Answer 2, 3, 1, 4, 5, 6. Rationale. On arrival of the client, the nurse immediately checks the client's airway for patency and then quickly administers 100% oxygen at atmospheric pressure or hyperbaric pressure to speed up the elimination of carbon monoxide from the hemoglobin and reverse hypoxia. The next most important action is assessment of the client's vital signs. Then blood is drawn initially and serially to monitor carboxyhemoglobin levels. Once they drop below 5%, oxygen may be discontinued. After assessment, treatment, and evaluation of the client's response, the nurse documents. If the episode was unintentional and precipitated by conditions in a dwelling, the health department is notified. 5. A client has been taking an antihypertensive for approximately 2 months. A home care nurse monitoring the effects of therapy determines that drug tolerance has developed if which of the following is noted in the client. 1. Decrease in weight. 2. Output greater than intake. 3. Decrease in blood pressure. 4. Gradual rise in blood pressure. Answer 4. Rationale. Drug tolerance can develop in a client taking an antihypertensive, which is evident by rising blood pressure levels. The physician should be notified, who may then increase the medication dosage or add a diuretic to the medication regimen. The client is also at risk of developing fluid retention, which would be manifested as dependent edema intake greater than output and an increase in weight. This would also warrant adding a diuretic to the course of therapy. 6. A client with a known history of panic disorder comes to the emergency department and states to the nurse, "Please help me. I think I'm having a heart attack." What is the priority nursing action? 1. Check the client's vital signs. 2. Encourage the client to use relaxation techniques. 3. Identify the manifestations related to the panic disorder. 4. Determine what the client's activity involved when the pain started. Answer 1. Rationale. Clients with a panic disorder can experience acute physical symptoms such as chest pain and palpitations. The priority is to assess the client's physical condition to rule out a physiological disorder. Although options 2, 3, and the 4th may be appropriate at some point in the care of the client, they are not the priority. 7. A client with trigeminal neuralgia, tachycardia, EUX, asks the nurse for a snack and something to drink. Which of the following selections should the nurse provide for the client? 1. Hot cocoa with honey and toast. 2. Vanilla pudding and lukewarm milk. 3. Hot herbal tea with graham crackers. 4. Iced coffee and peanut butter and crackers. Answer 2. Rationale. Because mild tactile stimulation of the face of clients with trigeminal neuralgia can trigger pain, the client needs to eat or drink lukewarm, nutritious foods that are soft and easy to chew. Extremes of temperature will cause trigeminal pain. 8. A child is admitted to the orthopedic nursing unit after spinal rod insertion for the treatment of scoliosis. Which assessment is most important in the immediate postoperative period? 1. Pain level. 2. Ability to flex and extend the feet. 3. Ability to turn using the log roll technique. 4. Capillary refill, sensation and motion in all extremities. Answer 4. Rationale. When the spinal column is manipulated during surgery, altered neurovascular status is a possible complication. Therefore, neurovascular checks including circulation, sensation, and motion should be done at least every 2 hours. Level of pain is an important postoperative assessment, but circulatory status is more important. Assessment of flexion and extension of the lower extremities is a component of option 4, which includes checking motion. Log rolling is performed by nurses. 9. A nurse has just finished assisting the physician in placing a central intravenous IV line. Which of the following is a priority intervention after central line insertion? 1. Prepare the client for a chest radiograph. 2. Assess the client's temperature to monitor for infection. 3. Label the dressing with the date and time of catheter insertion. 4. Monitor the blood pressure, BP, to assess for fluid volume overload. Answer 1. Rationale. A major risk associated with central line placement is the possibility of a pneumothorax developing from an accidental puncture of the lung. Assessing the results of a chest radiograph is one of the best methods to determine if this complication has occurred and verify catheter tip placement before initiating intravenous AIIMS therapy. A temperature elevation related to central line insertion would not likely occur immediately after placement. Labeling the dressing site is important but is not the priority. Although BP assessment is always important in assessing a client's status after an invasive procedure, fluid volume overload is not a concern until AV fluids are started. 10. A child has just returned from surgery and has a hip spica cast. A priority nursing action at this time is to 1. Elevate the head of the bed. 2. Abduct the hips using pillows. 3. Turn the child on the right side. 4. Assess the child's circulatory status. Answer 4. Rationale. During the first few hours after a cast is applied, the chief concern is swelling that may cause the cast to act as a tourniquet and obstruct circulation, resulting in compartment syndrome. Therefore, circulatory assessment is the priority. Elevating the head of the bed of a child in a hip spica cast would cause discomfort. Using pillows to abduct the hips is not necessary because a hip spica cast immobilizes the hip and knee. Turning the child side to side at least every 2 hours is important because it allows the body cast to dry evenly and prevents complications related to immobility. However, it is not a higher priority than checking circulation. 11. A nurse is assessing a client with a brainstem injury. In addition to performing the Glasgow Coma scale, the nurse plans to 1. Perform arterial blood gases. 2. Assist with a lumbar puncture. 3. Perform a pulmonary wedge pressure. 4. Check cranial nerve functioning and respiratory rate and rhythm. Answer 4. Rationale. Assessment should be specific to the area of the brain involved. Assessing the respiratory status and cranial nerve function is a critical component of the assessment process in a client with a brainstem injury because the respiratory center is located in the brainstem. Options 1, 2, and 3 are not necessary based on the data in the question. 12. A client has had a Miller-Abbott tube in place for 24 hours, which assessment finding indicates that the tube is located in the intestine. 1. The client is nauseous. 2. Bowel sounds are absent. 3. Aspirate from the tube has a pH of 7. 4. The abdominal radiograph report indicates that the end of the tube is above the pylorus. Answer 3. Rationale. The Miller-Abbott tube is a nasoenteric tube that is used to compress the intestine and correct a bowel obstruction. Nausea should subside as decompression is accomplished. Although bowel sounds will be abnormal in the presence of obstruction, the presence or absence of bowel sounds is not associated with the location of the tube. The end of the tube should be located in the intestine, below the pylorus. The pH of the gastric fluid is acidic and the pH of the intestinal fluid is alkaline. 7 or higher. Location of the tube can also be determined by radiographs. 13. While a client with myxedema is being admitted to the hospital, the client reports having experienced a lack of energy, cold intolerance, and puffiness around the eyes and face. The nurse knows that these symptoms are caused by a lack of production of which hormones? 1. Luteinizing hormone, LH. 2. Adrenocorticotropic hormone, ACTH. 3. Triiodothyronine, T3, and thyroxine, T4. 4. Prolactin, PRL, and growth hormone, GH. Answer 3. Rationale. Although all of these hormones originate from the anterior pituitary, only T3 and T4 are associated with the client's symptoms. Myxedema results from inadequate thyroid hormone levels, T3 and T4. Low levels of thyroid hormone result in an overall decrease in the basal metabolic rate affecting virtually every body system and leading to weakness, fatigue, and a decrease in heat production. A decrease in LH results in the loss of secondary sex characteristics. A decrease in ACTH is seen in Addison's disease. PRL stimulates breast milk production by the mammary glands, and GH affects bone and soft tissue by promoting growth through protein anabolism and lipolysis. 14. A client is admitted to the hospital with a suspected diagnosis of Graves' disease, which is SYMP. Tom related to the client's menstrual cycle would the client likely report 1. Amenorrhea, 2. Menorrhagia, 3. Metrorrhagia, 4. Dysmenorrhea. Answer 1. Rationale: amenorrhea or a decreased menstrual flow is common in the client with Graves' disease. Menorrhagia, metrorrhagia, and dysmenorrhea are also disorders related to the female reproductive system. However, they do not manifest in the presence of Graves' disease. 15. A client with gestational hypertension is in active labor. The nurse most likely expects to note which assessment finding: 1. Increased urine output, 2. Increased blood pressure, 3. Increased fetal heart rate, 4. Decreased brachial reflexes. Answer 2. Rationale: the major symptom of gestational hypertension is increased blood pressure. As the disease progresses, it is possible that increased brachial reflexes, decreased fetal heart rate and variability, and decreased urine output will occur, particularly during labor. 16. A nurse has just administered a purified protein derivative PPD skin test to a client who is at low risk for developing tuberculosis. The nurse determines that the test is positive if which of the following occurs: 1. An induration of 15 mm, 2. The presence of a V, 3. A large area of erythema, 4. Complaints of itching at the injection site. Answer 1. Rationale: an induration of 10 mm or more is considered positive for clients in low-risk groups. The presence of a wheal would indicate that the skin test was administered appropriately. Erythema or itching at a site are not indicative of a positive reaction. 17. A nurse is performing an otoscopic examination on a client with a suspected diagnosis of mastoid itis. The nurse would expect to note which of the following if this disorder was present: 1. A mobile tympanic membrane, 2. A transparent tympanic membrane, 3. A pearly-colored tympanic membrane, 4. A thick and immobile tympanic membrane. Answer 4. Rationale: otoscopic examination in a client with mastoiditis reveals a red, dull, thick, and immobile tympanic membrane with or without perforation. Options 1, 2, and 3 indicate normal findings in an otoscopic examination. 18. A nurse is reviewing the record of a client with a disorder involving the inner ear. Which of the following would the nurse most likely expect to note documented as an assessment finding in this client? 1. Complaints of tinnitus, 2. Complaints of burning in the ear, 3. Complaints of itching in the affected ear, 4. Complaints of severe pain in the affected ear. Answer 1. Rationale: tinnitus is the most common complaint of clients with ear disorders, especially disorders involving the inner ear. Symptoms of tinnitus can range from mild ringing in the ear that can go unnoticed during the day to a loud roaring in the ear that can interfere with the client's thinking process and attention span. The assessment findings noted in options 2, 3, and 4 are not specifically noted in the client with an inner ear disorder. 19. A nurse has a prescription to administer hydroxy, zine, Vistaril to a client by the intramuscular route. Before administering the medication, the nurse tells the client that 1. Excessive salivation is a side effect, 2. There will be some pain at the injection site, 3. There will be relief from nausea within 5 minutes, 4. The client will have increased alertness for about 2 hours. Answer 2. Rationale: hydroxyzine is an antiemetic and sedative hypnotic that may be used in conjunction with opioid analgesics for added effect. The injection can be painful. Medications administered by the intramuscular route generally take 20 to 30 minutes to become effective. Hydroxyzine causes dry mouth and drowsiness as side effects. 20. A client with diabetes mellitus has a blood glucose level of 644 mg per deciliter. The nurse interprets that this client is most at risk of developing which type of acid-base imbalance? 1. Metabolic acidosis, 2. Metabolic alkalosis, 3. Respiratory acidosis, 4. Respiratory alkalosis. Answer 1. Rationale. Diabetes mellitus can lead to metabolic acidosis. When the body does not have sufficient circulating insulin, the blood glucose level rises. At the same time, the cells of the body use all available glucose. The body then breaks down glycogen and fat for fuel. The byproducts of fat metabolism are acidotic and can lead to the condition known as diabetic ketoacidosis. Options 2, 3, and 4 are incorrect. 21. The nurse reviews the client's most recent blood gas results that include a pH of 7.43, PCO2 of 31 mm Hg and HCO3 of 21 MEQL. Based on these results, the nurse determines that which acid-base imbalance is present. 1. Compensated metabolic acidosis, 2. Compensated respiratory alkalosis, 3. Uncompensated respiratory acidosis, 4. Uncompensated metabolic alkalosis. Answer 2. Rationale. The normal pH is 7.35 to 7.45. The normal PCO2 is 35 to 45 mm Hg and the normal HCO3 is 22 to 27 MEQL. The pH is elevated in alkalosis and low in acidosis. In a respiratory condition, the pH and the PCO2 move in opposite directions, that is, the pH rises and the PCO2 drops. Alkalosis or vice versa acidosis. In a metabolic condition, the pH and the bicarbonate move in the same direction. If the pH is low, the bicarbonate level will be low also. In this client, the pH is at the high end of normal, indicating compensation and alkalosis. The PCO2 is low, indicating a respiratory condition, opposite direction of the pH. 22. The nurse is caring for a client with a nasogastric tube that is attached to low suction. Which acid-base disorder is most likely to occur in this client? 1. Metabolic acidosis, 2. Metabolic alkalosis, 3. Respiratory acidosis, 4. Respiratory alkalosis. Answer 2. Rationale. Loss of gastric fluid via nasogastric suction or vomiting causes metabolic alkalosis because of the loss of hydrochloric acid HCl and acid secreted in the stomach. Thus, the loss of hydrogen ions in the HCl results in alkalosis. Because the respiratory system is not involved, the alkalosis must be metabolic. 23. The nurse reviews the results of a blood chemis try profile for a client who has late-stage salicylate poisoning and metabolic acidosis. Which serum study does the nurse review for data about the client's acid-base balance? 1. Sodium, 2. Potassium, 3. Magnesium, 4. Phosphorus. Answer 2. Rationale. A client with late-stage salicylate poisoning is at risk for metabolic acidosis because acetylsalicylic acid increases the client's hydrogen ion HDH concentration, decreases the pH and creates a bicarbonate deficit. Hyperkalemia develops as the body attempts to compensate for the influx of HDH by moving HDH into the cell and potassium out of the cell. Thus, potassium accumulates in the body. Clinical manifestations of metabolic acidosis include the clinical indicators of hyperkalemia, including hypopnea, central nervous system depression, twitching, and seizures. Options 1, 3, and 4 are not a primary concern. 24. An emergency department nurse prepares to treat a child with acetaminophen Tylenol overdose. The nurse reviews the physician's prescriptions, expecting that which of the following will be prescribed. 1 protamine sulfate, 2 succimer, chimet, 3 vitamin K, phytonadione, 4 acetylcysteine, mucomist. Answer 4. Rationale. Acetylcysteine, mucomist, is the antidote for acetaminophen overdose. It is administered orally or via nasogastric tube in a diluted form with water, juice, or soda. It can also be administered intravenously. Prot. Amine sulfate is the antidote for heparin. Succimer, chimet, is used in the treatment of lead poisoning. Vitamin K is the antidote for warfarin. 25. The nurse should consider which of the following when determining whether a client with respiratory disease could tolerate and benefit from active progressive relaxation. Select all that apply. R1 social status, R2 financial status, R3 functional status, R4 medical diagnosis, R5 ability to expend energy, R6 motivation of the individual. Answer 3, 4, 5, 6. Rationale. Active progressive relaxation training teaches the client how to effectively rest and reduce tension in the body. Some important considerations when choosing the type of relaxation technique is the client's physiological and psychological status. The client needs to be motivated to participate in this form of alternative therapy to obtain beneficial results. Because active progressive relaxation training requires a moderate expenditure of energy, the nurse needs to consider the client's functional status, medical diagnosis, and ability to expend energy. For example, a client with advanced respiratory disease may not have sufficient energy reserves to participate in active progressive relaxation techniques. The client's social or financial status has no relationship with his or her ability to tolerate and benefit from active progressive relaxation. Options 1 and 2.